saying that this is a project that has passed a year of activities at this point. It's an EU project that we are talking about that was in the first wave of EU projects being granted funding for COVID-19 research. Now, what do we do that is different from the other EU projects? We focus on 4 main aspects, and these will be represented in these 4 different work packages as well that you will get special presentations or mini presentations of right now. These 4 aspects are crisis governance as one, where Kees Boersma is going to present some of the findings where we are right now. Then we have a work package that looks at local epidemiological spread. Particularly interesting here are 2 main endeavors. One is to look at really like the behaviors and movements of people and how they make a difference in any kind of epidemiological patterns. Secondly, there is also a public health care system analysis in this work package that has been quite instrumental in looking at ICU capacities, for example, and how to maybe add surge capacity versus how to also look at patient distribution in a different way. Our own work package at Hanken is the one on medical logistics and supply chains. We will return to that a little bit later, and that's also where you will get some latest research results from our partners Squadron. And last but definitely not least, there is a huge endeavor here about looking at misinformation and fact-checking that we will also get a presentation of in this particular slot. Now, what do I want to highlight about HERoS in general? We are, of course, a consortium behind this project. We happen to lead it at the Hanken School of Economics and the HUMLOG Institute, but this project would not be anywhere without our fantastic partners, both in academia, which you can see here. You have, as Joanna mentioned, we have Vrije Universiteit Amsterdam, TU Delft, the Open University. These are our main academic partners here. But then we also have very, very important end user partners. So we work very closely together here with Croce Rossa Italiana, and I see that some people from CRI have just joined also this session with Project Hope, and also the Polish Center for International Aid, PCPM. Then there are company partners involved here and so forth. So it's quite a consortium that we are representing, and we are trying to give you a glimpse of all of it. Now, most importantly, 6 months ago, we had a very similar session, and we have had a presentation of all the results until then. So amongst all the links that have been shared with you, you will find also a recording of that session. What will be different now is that we are bringing it a lot more up to date of what has happened also since. So you are getting a bit of a sneak peek, so to say, to research that has not been published yet. I hope you stay with us, and I hope you find it interesting.
Thank you, Gyöngyi. And then now we have Kees that he's going to present the working package 1 of the HERoS project that focus on the crisis governance, and he's going to present a very interesting case study. Kees, the floor is yours.
Thank you, Jana. My name is Kees Boersma from the Vrije Universiteit in Amsterdam. I have the honor to coordinate a work package on crisis governance. Next slide, Jana. We have an objective in this work package to understand the decisions made during the COVID-19 crisis, not just in response to the crisis, but also the kind of measures put in place to fight the pandemic. But then also, in addition, we would try to understand the mitigation strategies of the consequences of the measures put in place. What is important for us is to understand the actions and decision-making and sense-making by the formal authorities. However, we make a plea in this work package also to understand bottom-up grassroots initiatives in response to the COVID-19 crisis. And that is because we think the type of crisis that COVID-19 requires what we call a whole of society approach, really an inclusive kind of approach towards fighting and responding to the pandemic. And the next slide. And that is because, obviously, the kind of crisis that we are facing is an enduring, ongoing or creeping crisis. It is affecting virtually all parts of society around the globe. And unlike, let's say, a fast-burning, sudden onset kind of crisis, it really needs many organizations responding to the crisis. Also, what we see over the course of the crisis, over the last year, that many unexpected organizations started to respond to the crisis situation, and also to the mitigation of the intended and unintended consequences of the measures, and also to what we call the secondary crisis. So it's not just a pandemic, but it is also causing problems with global supply chains. It's also causing an economic crisis. It's also causing psychological need of people affected by the crisis. So it is a slow-burning, creeping crisis. It is cross-border. Obviously, it's transboundary. And hence, it needs that approach. So our plea for the whole society governance approach is also making a case, literally, for a improved collaboration between formal authorities and bottom-up spontaneous activities in society. Next slide. And how can we position those organizations that start to respond to the crisis in various ways? We then adopted a taxonomy from disaster science literature, in which you can group the kind of organizations responding to the crisis and how they can potentially collaborate and coordinate their actions. So you find organizations who have a regular task to play in crisis situations like this, like in pandemics. In the Netherlands, for example, there is the RIVM, an important governmental organization in charge of all kind of decisions fighting the pandemic and in implementing mitigation strategies. There are, however, also organizations or forms of organizing that we found that have non-regular tasks in relation to a pandemic like the COVID-19. Those are what we call extending organizations and emergent groups. And I have two cases, literally, to also make a case of taking those initiatives more seriously and to really include them into the governance approach. So the first one, next slide, is about an emergent group. Here you see two examples of citizen groups responding to the COVID-19 crisis by providing free meals to the most vulnerable people in their own neighborhoods. So it's an example from Amsterdam, where you see that on the picture that people living in the neighborhood started to supply free meals to people most in need in their own neighborhood. At the right-hand side, you see a similar example from Rome, Italy. Actually, a case provided by one of our partners in the HERoS project, so the Red Cross in Italy. So Agnese Rollo, I know that you are also in the audience. So she provided this case. And interestingly, similar things happen in different parts of Europe, and I should say also in other parts of the world, around the globe, really, in what has been labeled, not a book written by me, but in a book labeled Pandemic Solidarity. This is for us really important to understand those grassroots emergent actions at times of the pandemic, and to include them actually also in the pandemic and crisis governance. So to get a more inclusive approach in relation to the pandemic. Next slide. This is an example, and I will give in the next, I think, 5 or 6 slides, a couple of quotes from this, from people we interviewed from this organization. It is an initiative in the Netherlands to start to produce face masks domestically by an organization that is called the Refugee Company, what I call a social enterprise. So what was at stake? Next slide. What was at stake is the vulnerability of the global medical supply chain. So the partners from Hanken obviously are way more have way more expertise on this than I am. So they also elaborated on this in the some of the deliverables to the HERoS project. But a long story short, there was a huge shortage of personal protection equipment, in particular face masks, in the Netherlands and then, of course, also in other parts of in other countries in Europe. So there was for the Refugee Company here was an opportunity to not just see a market as an enterprise, but really from their social entrepreneurial kind of behavior, trying to respond to the crisis to mitigate the situation. So the idea was to domestically produce face masks. And that is what they started up with. And this is a case that we studied and presented in one of the deliverables to the HERoS project. Next slide. So in a nutshell, what is the Refugee Company? That didn't came out of the blue during the COVID-19 crisis, but it was established by a group of volunteers during the previous, what is known as refugee crisis in 2015. They started to respond to the refugee crisis, not just in a response to the crisis itself, but really in collaboration with the refugees themselves. So the refugees were taken up as a valuable human resource in their company. And ever since they do work in responding to societal crisis situations, adding value to society. So that is at the heart of their enterprise. They wanted to step in during the COVID-19 crisis in the early wave, in the early phase of the crisis, so last spring, actually. And they shaped a network of stakeholders that could support them in this mission. So the Philips Foundation was one that has in its mission to reduce healthcare inequality and also advise startups and companies to contribute to this issue, and credits and foundation that actually is doing microfinancing. So that was the support. And what was interesting for in this case, and that is why it is an important case also for HERoS and for COVID-19 crisis governance, is that they started to collaborate and build coalitions with the formal authority in the Netherlands, in particular with the coordination unit for the distribution of personal protection equipment in the Netherlands, the LCH. So that was established in the Netherlands by the ministry. So there was that joint venture between this social enterprise and the Dutch government. So typically an example of that whole of society approach. So next slide. So this was their product, producing the face mask, not for the specialized units in hospitals, but for nursing homes, schools, the kind of mask that you also can use to do your shopping and to walk on the street. So this was the idea to start up that production. But that was easier said than done. What was interesting that the whole story came about in in how they eventually managed to domestically produce those face masks here in a city in the Netherlands. Next slide. So I will run you through 4 slides with some quotes that we cut from the interviews that we did with the people working in the refugee company and producing the face mask, and with some of their stakeholders. So interestingly, the co-founder of the refugee company, her sister, she worked at the aviation sector, at KLM in particular. So she managed, through her informal network, to import production machines, because remember, there was no domestically production. There was no a production line in the Netherlands to start the production of face masks. So she had to start from scratch, which I call, from a governance perspective, creative improvisation. Next one. And in setting up that, so in bringing in the machines, that was in the Netherlands, that was one thing, but then you don't have a production line. So setting up the production line was really a collaborative effort between them, the refugee company, and a engineering firm, King, who contribute to setting up the production line by providing in-depth engineering knowledge on how to do it. Next slide. So personal networks in these kind of bottom-up approaches are really important, not just for bringing in machines, not just for setting up a production line, but also for bringing in the material that is needed to produce a high-quality face mask. Next one. And eventually, in producing a face mask, questions emerge about the quality, about the consistency of the production, a whole bunch of challenging questions on actually how to make this happen. So the refugee company not just invested in the production line, not just invested in the quality of the end product, but also made sure that their product was satisfied, got the certification that was needed to actually put it on the market. Next slide. So the production eventually happened, took part as of late 2020. And it is now delivering millions of face masks to the Dutch government, using their own skill sets, working together still with refugees that are part of their human resources, working together with a variety of stakeholders, including formal authorities and the Dutch government. Next slide. And actually firmly embedded in organizations that not just provide knowledge to produce it, but also providing resources in terms of finance, and working together not just with the formal authorities at the national level, but also with municipalities, in this case in particular Arnhem, where they were able to set up the production line. Final slide. So what is this? What does this story, what does this case study tell us? One, it is the importance of recognizing the value of bottom-up initiatives of the private sector, initiatives of a social enterprise in responding to a crisis situation, in particular the mitigation of the shortage of PPEs. So the main message is that there is a great value in those bottom-up generated initiatives that I think, we believe, deserve even more attention in strengthening, in this case, the supply chain of PPEs, in particular face masks. Thank you. There was a bit of a background noise, but so this in a nutshell was a case study that is a representation of the kind of bottom-up initiatives that we study in the work package one. Thank you, Jana.
Thank you very much, Kees. Thank you very much. Very interesting presentation and very interesting case study. And now I give the floor to Tina Gomez from Delft University of Technology. And Tina, over to you.
Thank you, and of course also thanks to Kees and to Gyöngyi and Johanna for the nice introduction. So now, after Kees spoke about governance, we are entering a very different realm, and that's simulation modeling. And I'm going to talk about how we have used simulation models in the context of this HERoS project to get insights into the spread of the epidemic and also to understand policies. But I would like to start with a bit of a more generic reflection on simulation models. Next slide. So I've been working for the last 10 years or a bit more on decision-making in disasters, including a lot of work on humanitarian disasters. And basically the question that we've encountered is always how to support rapid decision-making, because we have a crisis going on that requires urgent response. But still, the situation that we are facing is quite complex. It's often dynamically evolving, and it is very uncertain. So I've been working on these questions, what I said, for more than a decade now. But around this project, of course, Gyöngyi also has said already, there's a wonderful team. But also at the TU Delft, where I'm based now, we have a wonderful team of researchers that is trying to address exactly this question. Now, the TU Delft is, of course, a technical university, and this is, it was right. Exactly. So normally, at a university like that, you will have, for instance, aerospace engineers that are designing very complicated engineered systems that have a big hunger, where there are a lot of people running around, maybe currently not so many, but where you have a lot of research and development. Now that works for these complicated engineered systems like an airplane or a spaceship. But we are now confronted with systems that are a little bit different. Next slide. We are talking about socio-technical systems. That is where, for instance, technology like medical technology or infrastructures that we have or that are disrupted interact with what people do. And that is exactly what Kees was talking about when he spoke about emergence. So we have sort of an overlay of an infrastructural layer, like a road network or like hospitals that are being built, with the people that are doing things on top of that infrastructural layer. And for these socio-technical systems, we use then simulation modeling. So instead of going to a nice lab with a lot of machinery, we try to understand how these things work in our computer. Why do we do that? Next slide. Yeah, exactly. So why are these models actually quite helpful? One, because they minimize cost. So of course, it is cheaper to do that in a computer than set up huge experiments and training sessions. Second, and really important in the humanitarian context, is that instead of trying things out and potentially putting people at risk that are beneficiaries, or also your own staff, it reduces risks to the people that are affected by the disasters, because before really actually doing it, you can try to understand the most important phenomena and effects in a computer, which is definitely a lot safer. And then thirdly, because we are confronted with so many uncertainties, this is a way to think through these uncertainties and to understand the implications of specific uncertainties for the path that you're currently choosing. So this as a prequel, and now of course I'm talking about what we have been doing in the HERoS project with, I've already said it, so not just me alone, but a great team of researchers that is behind it. And Michael is also here to also answer any further questions that you may have. Okay, next slide. I've already said that we are confronted with a lot of uncertainties, and that is definitely true also in the context of that virus. The ones of you that have been working in disaster response are probably not surprised by it. But sort of there are three main sources of these uncertainties. One is the virus in itself. We first had to understand the epidemiology behind it, but then there are also new variants of concern that definitely change the way the virus spreads or also infects people. Then secondly, we have behavior. So what people do when they are confronted with the virus, or when when policies are imposed on them, actually also has been changing. And we see now increasing fatigue where people don't want to follow the rules anymore. And then the third aspect of uncertainty is actually what states do and what authorities decide. And also that has been changing quite dramatically and drastically, even in blocks like the European Union, where there is still no consent. So I'm based in the Netherlands. We are now reopening the terraces, although the weather is quite bad today. But on the other hand, Germany is going into a stricter lockdown. So you see this lack of coordination. Next slide. What do we do then with that? So given the policies, virus mutations, and the behavioral effects, we try to understand what are new local hotspots, which population groups are affected most, and what actions should be taken. What I want to say here is that we are actually really saying we do that locally. So you will see a lot of models that are also proposed, for instance, by Global Pulse and a higher level. These normally work at country or very regional level. But here we are really trying to understand the patterns at a very, very local level, and that has the advantage that we can understand also these hotspots and the way people are infected at a much more granular and detailed level. Next slide. So how do we do that? The model intuition is that we have built what we call an artificial city. The maybe more fancy name for that, it would be a digital twin, where we basically try to put the city, all the buildings and infrastructure that are in the city, as well as then what the people do in the city, into a computer to simulate that. So what you see here is that you actually have people that meet others, that use, for instance, public transports to travel to location and then carry out activities. So for instance, you use a bus to go to a supermarket and then you do your shopping. Through these activities, you meet other people, and that's how the disease actually spread. All of that is, of course, influenced by the policies that we are facing. Now, that's what the model does in a nutshell, at a bit more higher level, because I saw also some academics. Yeah. Next slide. Some academics in the audience. So, yeah, click. So, formally, we have sort of a coupled model that combines a discrete event simulation with an agent-based model. On the virus side, we have, like many other models, sort of a third-like model that takes into account a couple of the key features of the epidemic spread. Then we have more than 500,000 agents. That is roughly the number of people actually also living in the city, with their specifics attached to them. Of course, you may ask, but how do you know what these people actually do? So for that, we used time surveys and also are calibrating it now on mobility data. And then we used approximately 200,000 locations from OpenStreetMap and statistical data to understand the built environment and the infrastructure in The Hague. Next slide. Okay, and this is then how the model looks. So this is a map of The Hague, and this is just to give you a quick impression of how that actually looks like. So we see here, that's actually the university. So Delft University has a location in The Hague, and there you can see the numbers going down because it's the time of the day where the students are actually leaving. And these numbers represent individual people that are then going from the university to actually one of the shopping and nice market streets in The Hague, where there are also a lot of cafes. So currently these numbers are still all on zero, but you will in a minute then see them go up, and all these shops are filling with people. And at this sort of very granular level, modeling at this level also, of course, allows us to track how and where the infection spread. That means at which sort of socio-demographic and age groups, and where actually the infections happen. So you see here sort of a breakdown from parks and recreation to supermarkets, kindergartens, schools, which are currently a hot topic. I think I leave it at this for this part of the model. If you want more information about that, of course, you can use the chat or send us emails. So what can we do, for instance, with that? So one aspect is that we can identify local. normally you would probably expect that most infections happen in the city center because that is the most densely populated area where most people live. But we see that these infections now, because of the lockdown decisions, start to spread very unequally across the city. People stay much more in their neighborhoods, in their close bubbles, and there, for instance, then local shops and supermarkets can become sort of infection hubs. Okay, next slide. We can, of course, also understand who is infected most. So because we have these social demographics behind the model, we can, for instance, of course, see that, who gets infected and by how much. In this scenario, we had a policy with a hard lockdown where only essential services are open, as it was in the beginning of the first lockdown. And this very clearly shows that, you know, not everybody is affected and infected in the same way. Certain groups in the population experience higher infection rates, basically because of what they do. And here very often you see that sort of the workers, that's the people that still do or are forced to go do their jobs, actually have the highest infection rates. Okay. Next, and that was a bit, that was a bit unexpected to us. The role of supermarkets in there, because in the hard lockdown, the supermarkets were sort of the only thing that was still open. They became the hubs where lots of the infections were spreading. And one of the lessons for us from that was that it's essential to prevent crowding, especially at supermarkets. And there, of course, the curfews, sort of that the fact that you couldn't go out here in the Netherlands, it was after 9 o'clock. Of course, that limited the time window that you had to go shopping to your supermarket, so potentially still, exacerbating the situation at supermarkets. And here we planned for planning in specific opening hours, allowed capacities, and so forth. So we've done all of this for The Hague. Next slide. But of course, we also know, and that's now going to the humanitarian agenda and the developing world, that COVID also has a lot of implications. Actually here for the achievement of all of the SDGs. So coming from that model and from really understanding, you know, how COVID spreads, we also did some work, sort of a side project, on trying to understand how and what we could do, knowing these phenomena, also for developing world. And there we started to look at informal settlements. Next slide. So we had a similar model set up with a CERT model that we did for a prototypical refugee camp. And also there we were, for instance, studying the impact of restricting movement around the settlement. What you can see here is very clearly that if there are no restrictions, or if just specific groups are restricted or sent into quarantine, that this is not very effective to combat the spread of the disease. Basically because there are still activities that people do, and then because of the conditions under which they live, people bring the infections back to their shelters or their families, and then it spreads there. So the only thing that actually did help was the whole households in quarantine when only one person is sick. Next. And then we also looked at distancing in queues, because of course there are so basically understanding that infections happen where there are crowds. So we were looking at, okay, how can we organize them better that people do not get infected in these queues? And we were running sensitivity analysis on the type of distancing. So you can see here that actually these 1.5 meter distancing policy, that is the green curves in the picture, are actually significantly lower for all sort of policies. So we see here that helps to flatten the curve. Okay. So in a nutshell, to wrap it up, we use simulation models here to support the response. Given uncertainties about local impact, behavior, and the contagiousness of the virus, we can help to find local clusters, understand who is affected the most, and then prepare actions really locally. And then specifically with that final example of the informal settlements and the queuing policies, we really also mean, you know, by zooming in to that extent, we can also help with crowd management or camp management and all these kinds of aspects. Yeah, and I will leave it at that, and I'm happy to answer any questions if you have.
Thank you.
You put it in at the end. There was one discussion about the slide. If you want to go back, I can also still say something.
Yeah.
Yeah, so we are also working on some dashboards where you can try to identify the impact of the policies. There's a better version that is built on ArcGIS, where you can see, for instance, also the impact of activating policies at different time steps. So as we all know, early action is quite important and have seen now multiple times, so that's not surprising anymore. And still, you might want to still hammer it into policymakers' heads at some point. Okay, so that's the one we built. And then, second slide. Gyöngyi was also mentioning that in the beginning. That's the healthcare capacity analysis that was done by NHG, which has a dashboard on the ICU capacity across all of Europe, the COVID patients that are currently treated in the ICUs, and the capacity overflow. And that allows to actually understand the capacity of the healthcare system, especially the ICUs, against COVID. So if you're interested in that, check out the dashboard. NHG COVID-19 map. It's quite a cool tool. Okay, that's it then. Really fine.
Thank you very much for your presentation. Very interesting. And now the next presentation will focus on the medical supply chain disruptions. And Gyöngyi, the floor is yours.
Thank you. Let me just maybe say a few words to start with. I mean, of course, with medical supply chain disruptions, we are now leaving a little bit of the focus on Europe and the focus on specific cities and so forth, which is, though anything that is being done in those kinds of aspects of work packages is going to be relevant worldwide anyway. But of course, medical supply chains are not local. And this is maybe one of the biggest messages to start up with, because we have a really big issue of especially policymakers to understand that whenever they shut down or have an export ban or want to even grab items off the tarmac of a delivery, that will have global repercussions. This is one of the biggest issues that we also found. Now, I'm not going to have a lot of animations or animated slides from this perspective, because in work package 3 you will have a lot more and cooler animated slides when it comes to some of our drone deliveries. But let me maybe revisit some of the things that we have found. And I will put one thing in the chat. One of the first articles that we have written from this HERoS project when it comes to supply chain management is what can pandemic response learn from humanitarian logistics. And it's kind of an interesting article in the sense that very often one has these parallels between business logistics, humanitarian logistics, what the two sectors can learn from one another. But in fact, when it comes to pandemic response, it is in fact humanitarian logistics that we can all learn from, and the humanitarian space. And we can learn from the pre-positioning and the preparedness aspects of it. We can learn from looking at global supply chains in general. But what have we found particularly in this project that might be interesting to everyone? One is, of course, when we looked at the first wave of the pandemic, and by first wave, I do mean mostly the time span between March to June, July 2020. That's when everybody was focusing on PPE. And we actually have all the time seen around the world shortages of PPE, then shortages of ventilators, shortages of respirators, to the extent that eventually there was a shortage of testing swabs for COVID-19, even the cotton for the test swabs. And I don't know if you've seen the news just from today, but right now we are running into a shortage of pipettes for labs. From a supply chain management perspective, what is interesting there is the following. In fact, when you look at the critical path analysis of all sorts of materials that are all interconnected and are needed for a COVID-19 response, you could actually see that once we are removing one bottleneck, we are hitting the next. And it is this critical path analysis thinking that helps in identifying the next bottleneck to come. Then Another thing that I would want to maybe highlight is all these issues that we've had with quality in product specifications. Of course, there have been ups and downs with what technical specifications and which items do we actually need in personal protection, protective equipment. But there are some other issues to it too. I mean, WHO is of course coming out with technical specs that even to the extent give you very good purchasing guidance of what to look at and what which kind of layers you want to have in, say, a face mask and all sorts of details like that. But at the end of the day, we don't have global quality standards for any of this. And why is this a problem? Well, usually when it comes to also humanitarian efforts, the idea is that you have a situation, say an epidemic somewhere in the world, and the rest of the world can come to help. Which also means that if you then suddenly need to have surge capacity and production of a particular item, you can focus on that item, maybe at the expense for a while of the other items, but at the end of the day, you will get there. Now, in a pandemic, that's not the case. So right now we are in the situation that every single type of specification is needed simultaneously around the world, and we do not have enough capacity. As Kees said, I mean, there are, of course, some manufacturing units that are trying to change over to these kinds of items themselves. There are new plants that are going to that are being set up everywhere in the world for PPE. Plus, of course, the whole idea of production changeover has been very instrumental. Now, what do I mean by production changeover? That's where you have existing manufacturing plants that could, with the same machinery or with very small adjustments to their machinery, produce something else that is similar. And because of this, be quicker in setting up a production line than something that needs to be set up from scratch. So that's been a very, very important aspect. And if you've seen, the automotive industry has, for example, started to produce ventilators and respirators based on this principle. But it's, and of course, textile industries have started to move over to PPE. Now, one thing that we have an issue with that right now is that, of course, in a lot of places in the world, there has been that kind of movement. Yet then, of course, globally production has started to catch up. And right now, a lot of these plants, and especially manufacturing plants for particularly PPE, are also being shut down again because there is now an overproduction and overcapacity of certain items. So we have these kinds of capacity issues, ups and downs. Moving on, now we have started to focus a lot more on vaccine supply chains. I mean, obviously this was not there from the beginning of the project. There was also no such thing as a vaccine to even consider. And here we are focusing on a few things and have maybe also a few messages here. One is about temperature control. Now, the ranges of the temperature that particular vaccines can be manufactured in, stored in, delivered in, and so forth are quite different from one another. And this is not news, again, especially to the humanitarian space. And if you think of it, even the temperature control issues and everything that comes with it, from the reefer containers to having to have the loggers of temperature loggers to all the energy requirements of that in the field are not news. Now, a lot of countries have, because of these temperature control requirements, gone over to wanting to wait for certain particular types of vaccines that are easier to implement. And we know that even in rural environments, say in the EU, that's the case, that because of the problems with ultra cold chains, there is a wish to go for those vaccines that don't require such. Well, now with variants on the rise and everything else, we really have to maybe just also pass on the message that there is no such luxury of waiting for what will work in your environment. Instead, what is much more important is to prepare every supply chain to be able to deal with all these different ranges of temperatures of vaccines. Now, there are three main ranges we are talking about when it comes to the final vaccines in COVID-19. One is the ultra cold chain, which in fact is the same type as for the Strive Ebola vaccine. So it's the same kind of mechanisms. And in fact, there is a lot of good research, also very detailed research on how to deliver those anywhere in the world. Then there is the frozen kind of supply chain that you can think of, which is basically the same as frozen foods, around -20 degrees Celsius. And then there is a cold chain, which often, in fact, is supposed to be plus temperatures, so that especially live ingredients of vaccines don't freeze. Upstream the supply chain, when it comes to manufacturing these vaccines, there are even different ranges, but these are the three downstreams. Now, other things we are finding, and with temperature control, let me just highlight that we came out with a temperature control fact sheet from HERoS, and that's what you find there as a link also on the slide, to help exactly with these considerations, and especially to highlight where and in which situations temperature control can break down in the supply chain. So that's for setting up vaccination programs in particular. Now, again, we have the same issues with export bans and quality problems and so forth. Maybe there are some other things that I want to highlight. One is whichever country makes a huge change in the vaccination program has a huge impact globally. We've had issues such as the timing of the booster jabs changing in some countries and leading to complete stockouts in other countries because manufacturers had deviated their deliveries to those countries again. We had price wars basically based on this. And we also currently still have the problem that a lot of countries, even though they pay lip service of sharing vaccines with the world, do not actually follow and implement what they say. So those are very important issues to consider. Maybe one more thing that I want to highlight is the issue of supply chain security. In vaccines, there are higher security considerations than in many other kinds of items. For all sorts of various reasons, we have to consider everything from counterfeit products to just the fact that these vaccines are in such high demand that there is a lot of people and organizations who just want to have them and thereby really want to get it from whether that's en route in a delivery or whether that's in a warehouse. But there is one other aspect when it comes to medical logistics and supply chain disruptions that we followed up in particular for the COVID-19 pandemic, and that has to do with the fact of how do we deliver in a safe manner. And one of the safe manners that we are considering here is the use of unmanned aerial vehicles, as to say drones. So I will leave it to Greg to take over from there and show you where we stand with those developments.
Greg, the floor is yours.
Okay, thank you, Gyöngyi. Thank you, Jana. Please, next slide. Let's move forward. Okay. Here in the HERoS project, we are developing the drone deliveries to the quarantine zone. And as you see here, our initial concept of those deliveries is far, far away from what usually you can read in the media about what explodes last year. So and this is the result of our as a company approach for the drone deliveries, and the history is we are trying to put it into life for over 4 years, and these are the contacts with Institute. Okay, so here in the project, started from the 150 kilos of delivery. So you see, this is not a drone; it's a big drone. Okay, so and the distance we are planning to, as an initial concept, was 500 kilometers. Right now, after 1 year, we know that 700 will be better. Okay, and our approach is not only to have a drone which can carry some kilos. this is also the question, and that's very important in this project, that this is also the question about organization of airlift. Regarding the humanitarian aid, regarding the medical aid supply, what is 150 kilos? But if we have 5 planes or even 10 planes on the theater, we can do the airfield. But the airfield is a matter of organization, and that's how we approach in this project. Initially, we started from a place which is quite well known, as I know. This is the Uganda, and we took into the consideration the flight from the Kakira airfield to a very important place like BDBD refugee area. Okay, please, next slide. How we approach with this project, in this project with a drone delivery. So you can see 3 areas of 3 directions of our approach. First of all is a cargo UAV system concept, that basically to do the drone delivery, you need the drone delivery system. Okay. The second one is a way of approach, is a simulation of the situation around the airfield, in the humanitarian area. Okay, and the third direction is simulated UAV operation. Let me focus on every of this direction a little bit detailed. Okay, so regarding we started the project in 2020, and as a drone community, drone industry, we were faced in the changing of the rules. We went to the conclusion that first of all, we will have a problem in the project if we start building the UAV. This is the big UAV. We need to certification, and we will have problems for flying regarding changing the rules. That's why we did some revolution. I would call it revolution, and we reversed the traditional way of designing the unmanned aerial vehicles, unmanned aerial system, and we approach it as we are preparing the design, we are preparing the concept, we are counting all the airplane, but we are putting it into the virtual model. To have a capability to fly, we are also designing and we are programming the real ground control station, which is the heart of the UAV system, and the pilot is sitting in front of the ground control station. And if we add for that the situation simulation, like logistic hub simulation, you will see that in the next slide here, and delivery point scenario simulation and airfield simulation. But actually, you can see the simulation on the pictures here. The left is simulated, the right is a Google Earth screens. And if we take everything into the real distances, we will do a lot of operations. For 1 year, we will do a lot of operation, a lot of cargo flights with a medical supply. And we will get a lot of information, a lot of conclusions, a lot of other directions of approach. And at the end, we have the simulated UAV operation. Means we are taking the real people sitting in front of the ground control station, doing them the airspace simulation, like air traffic correspondents, air traffic controllers. They need to do the real operations calculations, and they need to fly. Okay, and please next slide. And because we are focusing not only just to have a drone, we are also focusing on what Gyöngyi says, the logistics approach. We also at this stage we also came to some results, and one of those results, and I would like to present it, is that the drone delivery system needs to define the delivery points. And what you see here on this slide is our proposal of such database, such description, and we took some areas of the delivery point to be described. First of all is description. Is it a hard surface? Is it an airstrip or a grass surface airstrip? Or this is only the flat terrain and there is no such thing like airstrip on the ground. The second category is a delivery point. We call it delivery point levels. Means this answers the question how we know those places or this place. Okay, is it the delivery point well known and used within last, for example, month or last week? Okay, this is to be updated. Or this is the delivery point known and used for more than 1 month from ago. Okay, or maybe this is the delivery point just checked by trained personnel, but never used for landing of the UAVs, or can be delivery point not checked by anyhow. And the third category, we choose the personnel presence, and this is very important because this is directly connected with what Gyöngyi said about the conditions of the deliveries of some medical materials like vaccines. You said about temperature. So if you are trying to deliver the vaccines by the drones, we also need to take care about temperature. But here is about the personnel. Means the first category is that we have the medical personnel on the delivery point. The next is there is no medical personnel, but there is a personnel who can unload and load the airplane, because we need to understand very important fact that if we land with the drone 500 kilometers away, there will be no pilot there. This is not a traditional aviation. Okay, so this is the person, should be the personnel who can unload the airplane on the delivery point. And the next category, not trained personnel. There is a personnel, but they are not trained anyhow to handle with the airplane, with the cargo. And category D is no personnel on the delivery point. And on the right side of the slide, you can see the examples of the categories from basically directly from the simulation. So first of all, you can see A1 alpha means the hard surface. We have the doctors or medics on spot, so we can safely land with, for example, vaccines, and we are sure that there will be somebody, or vaccines or drugs, for example, there will be somebody who can handle properly with those materials. The second example is A3B. Means basically there are people, for example, here they are the UN forces. It can be NGOs forces to handle with the cargo, with the medical equipment, with the medical materials. And at the end, you see the C4 Delta. There is nothing. There is a flat terrain. This is not checked. No personnel over there. But there is a need to deliver the medical aid, and actually, this is the picture. This is the picture who opens the quite big discussion among the people involved in the project. If the drone dropping, because you can see here the dropping, if the drone dropping from the drone opens the new way of the delivery of medical aid. In my opinion, yes, drones opens the doors for controlled drops of medical or humanitarian aid in the humanitarian operations, not only COVID, but all over the world. This is for the further discussion. Of course, to do it, it cannot be done like let go and drop. No, it needs to have the logistic chain, the organization of the delivery, the organization of the dropping, but it is but the drones opens the humanitarian aid for also for dropping. Okay. Thank you very much. Or if you have any question, please.
Thank you very much, Greg and Gyöngyi, for your presentation. And now I'll give the floor to Harith. He's going to talk about social media analytics during COVID-19, so misinformation during COVID-19. So Harith from Open University, the floor is yours.
Hi, thank you. So in this work package, we are trying to look at two different things. One of them is the spread of misinformation, which I will be talking about today. And the other one is processing the help requests that people tends to send around, either on social media or on specific groups that aid organizations are setting up, which I will probably talk about on another occasion. Now, obviously, misinformation has kind of came hand in hand with the pandemic. I don't think ever in history we had the problem at a similar scale as we've seen since the pandemic started. Just the other day, I found out that there has been around 10,000 false claims circulating only about COVID, and so it's definitely what the WHO calls an infodemic, because it adds to the complexity of the problems, and it's a global problem. As you can see from this map, this shows the emergence of the misinformation all around the globe. There are no countries that have been immune from the issues. Now, some of the misinformation is a little bit just annoying or harmless in a way. Like, if you eat garlic, you will be protected from COVID, which is not true. It will just give you a bad smell, but it's not going to affect you probably beyond that. But there are ones that have proved to be fatal. For example, in Iran, they were drinking methanol, and about 700 or 800 people died from that. On the other hand, you can argue that if you believe in false protection methods, like if you eat bananas or inhale steam, then you're not going to catch the virus, then that might stop you from taking other precautions, other measures, like wearing a mask or even taking the vaccine. So in the end, all misinformation can be quite harmful, even though sometimes it's really difficult to measure that. And the response to the infodemic has been unprecedented as well. So many governments have set up actions to curb the spread of misinformation, to publish corrections to some of these claims. The number of fact-checking organizations, I think, rose about 400% since the pandemic, just to deal with the scale of the problem. WHO and many other organizations have also started their own campaign to debunk myths whenever they are found. And also from the technology perspective, so my team and I come from the technology side. Again, there is a lot of work trying to figure out what AI and automated methods that could be used to automatically detect misinformation, and also social media platforms are also struggling to come up with new solutions to this problem. So the work that I will talk about today goes a little bit more in the direction of what analysis we've done so far, and it's mainly done by my team, Dr. Grzegorz Barrel and Dr. Tracy Farrell, who have been managing this project from our end. Next slide, Alani, please. So, like I said, there has been about 10,000 false claims circulating only around COVID. And the graph that you see, this shows the number of misinformed URLs that clearly contain false claims, and the number of times they've been shared on Twitter. So this is only Twitter, which is the platform that we've been mainly analyzing, where a lot of misinformation has been spreading. You can see that at the start of the pandemic, at least here in the UK, this is, or mainly main parts of Europe, this is when it started to become more felt all around. So back in March till May, that was the peak of the spread of many of those claims, which luckily kind of came down as time went by, but we still witness quite a high level of such content being circulated. And there are many different types of this misinformation. So in most of the research that you find today that does similar analysis of misinformation, they treat all of it to be more or less the same thing, like, you know, a false claim is a false claim. But of course, that's not always the case. So when we look at the different misinformation circulating around COVID, you find some of them are related to how it spread. So they would, you know, make some false claims about its spread or the number of fatalities. Others to do with false cures. Others are conspiracy theories that come, like, you know, 5G and COVID. Others to do with the vaccine and so on. So the type of misinformation that is circulating is something that we're also trying to look at and take into account in our analysis. Next slide, please. So one of the things that we've been doing in our monitoring of the circulation of misinformation and the circulation of their fact checks, and this is kind of what we're trying to do in HERoS, that's slightly different from elsewhere, is that we feel that it's not enough to only monitor the spread of misinformation. We have to monitor the spread of the fact checking as well, the corrections, because this is the response that, whether it's coming from a government or from a fact checking organization or from the social media platforms themselves, we have to measure how the fact checks are spreading, the corrective information is spreading as well. So on the top left table, for example, I've blurred the misinforming URLs because I just didn't want to emphasize them. But there you see, this is kind of a weekly report. This is this week's report of which are the false claims that have been circulating the most, and how does that compare to last week's. And the similar thing we're trying to do with the bottom table to the fact checks. So these are the fact checks that seem to be circulating this week, that and how that number is going up or down. The idea of this kind of simple statistics that we're collecting is just to help us and any other stakeholders to see, for example, which claim needs to be curbed a bit more strongly, which fact checking needs to be broadcasted perhaps a little bit more forcefully to tackle some of these problems. And like I said, the importance of looking into the fact checks alongside the misinformation is that it gives us a very strong indicator that this is a claim that was fact checked and we know it's not true, but also to try and see what we can do to broadcast the fact checks a little bit more effectively on these platforms. Next slide, please. So we've done a bit of analysis so far. I'm not going to get into any of the details, but of course, Greg would be happy to answer any questions. We have some papers published, but one of the studies that we have done, we've done it to have a little bit better understanding of how misinformation and fact checks spread together. So these were the questions that we tried to answer is, do they spread in a similar fashion on Twitter, or do they spread very differently? And do these spreading patterns, do they differ with regards to the topic of the claim or with the demographics? So we try to look at age and gender. Or what about time? So do they, for example, when it first emerges, does it spread slightly differently than if it's a bit older? And how does that the emergence of a fact check influence the spread of a false claim? So we've looked at a data set that contains, like I said, it's pairs of false claims as well as the corrective article that's published by a legitimate fact checker. In some cases, the same claim was fact checked by multiple fact checkers. So we have a slightly higher number of fact checks. And we've looked at about 3.5 350,000 tweets. Now, of course, the data we looked at is limited to Twitter, but it's also limited to seeing the exact URL that points to the false claim. So let me just explain how this works. So the fact-checking organizations, they would pick up a URL that happens to contain a false claim. They will say, I've looked at this URL, it contains this claim. This is what I think about this claim. It's false, it's misleading, it's true, and so on. So we look for that particular URL that the fact checker has picked up. That does not mean that the claim was not circulated without, in some other ways. But we wanted to be absolutely certain that when we find a claim, we know that this is the exact same one that the fact checker has looked at. Next, please. So what did we find? So the way we've done the analysis is to look at the spread in average. So we're not looking at the spread of a particular claim, but we look at the spread of all of those claims. So on average, how did they spread? And we've looked at 3 different time zones. We've done some analysis to find out what are the distinctive time periods, if you like, for the spread of misinformation as well as fact checks. And we came to these 3 categories. The initial one, which is just on the first 3 days of the appearance of the claim or of the fact check. And the other one is about a week after that, and then 10 days and more. That's when things to kind of not change much, if you like. The spread continues in a more regular way. So the first thing that we have found is that we can predict how one of them spreads from knowing how the other one spreads. So what I mean by that is that if I look at the spread of misinformation, I can predict how fact-checking is going to spread, and vice versa. So this is kind of useful because it means that there is some connection between them. There is some kind of an influence that one is having on the other. So if misinformation is spreading, we can then presume that is going to be picked up by fact-checking organizations, and then we will have that available. And if there is some fact-checking that has been published, then we know that there is a slight impact on how misinformation is going to spread after that, which is also good news. We did find some differences across the 3 periods in terms of how they spread, that we're also trying to understand a little bit better now. But we found when we looked at the types of the misinformation and how they spread, we found that the ones that stand out are the ones that are related to the cause of COVID, so the origin of the virus, for example, and some of the conspiracy theories associated with the pandemic as well. Those 2 types seem to be a little bit more immune to fact-checking. They just continue to reappear even after a long time from their emergence. And even if there is a fact check that's been published about them that says this is false, they don't seem to be too affected by that. In fact, I've been monitoring one such misinformation, which is about the COVID and how it was engineered in a lab. And whenever I see someone posting that, I reply to them using another account to say, by the way, this has been fact-checked. You may want to look at this fact check that says this is false. And yet, even though that article has been around for over a year, that was fact-checked, it still comes up. Every now and then, there's one organization or someone will bring it back to the surface. So that kind of confirms that there is an issue with certain types that seem to be a little bit more difficult to curb. In the initial period, which is from 0 to 3 days of the emergence of the misinformation, we looked at how these spread by organizations. So an organization could be, for example, a news agency or some political group, versus how people like you and I would spread it. Just to try and understand the role that people play here. So in the initial period, we found that actually the fact checking as well as the misinformation seem to be seem to be spread equally. But then later on, after 10 days, we see that actually now they start to differ. So individuals and not organizations, they spread misinformation and fact-checking similarly. Organizations don't. So that helps to understand a little bit better, for example, if you want to target our campaigns to emphasize fact-checking, how we should do that. One good thing is that we didn't find any difference between whether women or men are sharing misinformation or fact checks, taking into account the imbalance of these genders on Twitter to start with. So we didn't find any differences between how we share them. Next slide, please. So one of the things that we have developed, which capture some of this information I mentioned, is what we call a fact-checking observatory. Now, there are quite a few COVID misinformation observatories out there, but what we try to do here, like I said earlier, is to observe not only misinformation, but also the fact checks for those, which I think is vital if we want to improve our response mechanisms. The URL is there. We are actually redesigning it, so it will change very soon. But the idea of it is to track misinformation as well as the fact checks, as I said, and it does that automatically. So it would give you a weekly report of what we have found on Twitter and compare that to the previous weeks. So far we've got about 10,800 fact checks. These are coming from the International Fact-Checking Organization. So one of the questions we always get asked is, well, who's checking the fact checks? But these are all legitimate ones that have been verified by that agency. Next slide, please. So this is just to give you an idea of what you would get from these reports. So it will give you some statistics about which misinformation, for example, was the most commonly shared that week, and for the fact checks, which are the most popular ones as well, but also where did they come from? So which fact-checking organization was beyond this popular one, what language, which country, and so on. So from there, you might be able to see that, for example, some of the fact checkers seem to be more successful than others, or fact checks from certain countries to be more visible than others. And also we give some information about the demographics in terms of age group and gender behind the accounts that might have shared the fact checks as well as the misinformation. Next, please. Now, what we're trying to do now, so we don't have answers to these new questions yet, is to try and understand whether there are some differences between countries when it comes to these spreads. So we're posing these two questions now. Do we see any differences between the countries, and how do these differences or similarities relate to the what we call the stringency indexes? So the stringency index would have parameters like, school closure or travel restrictions or wearing masks and things like that, that some countries adopt. So this comes to like the governance and policies. And so there are some shared information out there that would give you kind of an index for each country. So this graph shows the stringency index for France, Germany, Italy, Spain, UK, and US, and how that's been changing over time. Next, please. And so what we've just started to do is to see whether there are any differences between the information we're getting from those countries. So we found that, and as a kind of a general finding so far, is that fact-checking spread seems to increase with the stringency peak. So when stringency peaks up, fact-checking seems to be enhanced, and this is probably because there are more fact checks being shared, or because people are sharing them beyond with their networks. But we did find some differences. So, for example, we found that in Germany and the UK, fact-checking and misinformation spread, they both decrease when stringency increases. Whereas in some other countries, we found that actually it goes the other way around. We don't know why yet, but one thing that we would like to do next is to look at specific indices in the stringency index, because even though the data we have that says, you know, this is the level of that index for this country, the reason why it's at that level might be different. Even if it's the same level for the UK and Italy, for example, the reasons for that or the values that went into it might be slightly different. So, for example, you know, one country would have a lockdown, the other country might not have a lockdown, but they have, for example, the schools are still closed. So even though the stringency index would give you the same value for both countries, but actually there are different parameters that are playing a role. So we would like to look into those, but also geolocation is never perfect. So what we're trying to look, when we look at the spread within a country, we're trying to geolocate the person or the organization that shared it on Twitter. That's never perfect, but it gives you a good idea of that spread coming from those countries. And we want to look at some of the parameters that was mentioned earlier in the other talks. We want to look at, for example, the health index or the GDP to see whether there are also any relations to these. So this is still ongoing work. We don't have many answers to these questions, but that's what we're working on now.
Thank you very much, Harith.
We're happy to answer the question.
I guess we finished now with the presentations. If you have any question, raise your hand and unmute yourself and ask the presenter. If you want to get updates about the project, please register to the mailing list. It's on the chat, and we really appreciate your time we spent to hear our research findings. Do we have any questions on the chat?
Not at the moment, but you're welcome to raise your hand and ask your questions directly.
Let's give some time to the people. Please reflect on what you heard, and maybe you can share issues that you are facing or challenges that you are facing in your organizations and how they can be a benefit from our research. Christiana, do we have questions? Or any?
No. We don't have questions, but as you noticed, there is a link to the mailing list, so you're welcome to subscribe to the mailing list, and it's in the chat.
If we don't have questions, just to wrap up, we went through 5 presentations. The HERoS is a research project that is funded by the EU Horizon 2020. So Kees from Vrije Universiteit in Amsterdam presented an inspiring case study from a refugee company that produce face masks. Then Tina from Delft University of Technology took us through the virtual city, simulated how the local behaviors they are affecting the spread of COVID-19. Then Gyöngyi from Hanken School of Economics and the HUMLOG Institute talk about the supply chain disruptions, the medical supply chain disruptions during COVID-19, and what we can learn from the humanitarian logistics in order to manage the pandemics. Also, Greg from Squadron presented their work for the drones And then in the end, Harith from Open University talk about misinformation and fact checking in the social media, especially in the Twitter. If you have later questions that are coming on your mind, just feel free to contact us. There is the mailing list here, and we will share the recordings and also the presentation with you. And you you can find on the HNPW website and also on the website of HERoS. Thank you very much.
Thank you, Jana.
Thank you, guys. I think I would do like that. Yeah.
Thank you.